Next question. What is a fracture of a vertebra often caused by osteoporosis or trauma? Answer. A vertebral compression fracture. Next question. What is the common name for hallux valgus? Answer. A bunion. Next question. What is the term for a bone that is out of its normal alignment? Answer. A deformity. Next question. What is the term for a fluid-filled cyst associated with a tendon sheath or joint? Answer. A ganglion cyst. Next question. What condition is caused by the compression of the median nerve in the wrist? Answer. Carpal tunnel syndrome. Next question. What is the softening of the articular cartilage on the back of the kneecap called? Answer. Chondromalacia patellae. Next question. In a developing fetus, what is the initial skeleton made of? Answer. Cartilage and fibrous membranes. Next question. At what age are most human bones fully ossified? Answer. By the mid-20s. Next question. What is the most critical mineral for bone health and structure? Answer. Calcium. Next question. Which vitamin is essential for the absorption of calcium in the intestines? Answer. Vitamin D. Next question. Which vitamin is necessary for the synthesis of collagen, a key bone protein? Answer. Vitamin C. Next question. What hormone, secreted by the parathyroid glands, increases blood calcium levels by breaking down bone? Answer. Parathyroid hormone, PTH. Next question. What hormone, produced by the thyroid gland, decreases blood calcium levels by inhibiting bone resorption? Answer. Calcitonin. Next question. What are the sex hormones that play a key role in regulating bone growth and closure of the epiphyseal plates? Answer. Estrogen and testosterone. Next question. What hormone, produced by the pituitary gland, stimulates overall bone and muscle growth? Answer. Growth hormone, GH. Next question. What is the term for the natural process of bone renewal where old bone is replaced by new bone? Answer. Bone remodeling. Next question. What is the term for the decrease in bone mass that is a normal part of aging? Answer. Osteopenia, a precursor to osteoporosis. Next question. What type of exercise is most beneficial for building and maintaining bone density? Answer. Weight-bearing and resistance exercises. Next question. What is the condition of abnormally large hands, feet, and face due to excessive growth hormone in adulthood? Answer. Acromegaly. Next question. What is the condition of short stature due to a defect in cartilage formation? Answer. Achondroplasia, the most common form of dwarfism. Next question. What is the name of the fontanelle, soft spot, on the top of a baby's head? Answer. The anterior fontanelle. Next question. When does the anterior fontanelle typically close? Answer. Around 18 to 24 months of age. Next question. What is the medical term for a slipped hip epiphysis? Answer. Slipped capital femoral epiphysis, SCFE. Question. What is the condition in children involving temporary loss of blood supply to the femoral head? Answer. Lake-Carpert's disease. Next question. What is the term for the wearing down of tooth enamel and dentin, often involving bone-like tissue? Answer. Tooth decay or dental caries. Next question. What is the hard, dense tissue that forms the outer layer of a tooth? Answer. Enamel, the hardest substance in the human body. Next question. What is the term for the small, extra bone sometimes found in sutures of the skull? Answer: sutural or wormian bones. Next question. What are the small, sesamoid bones embedded in tendons, with the patella being the largest? Answer: sesamoid bones. Next question. What is the term for a narrow, ridge-like projection on a bone? Answer: a crest. Next question. What is a large, rounded, articulating knob at the end of a bone? Answer: a condyle. Next question. What is a hole in a bone for the passage of blood vessels and nerves? Answer: a foramen, plural, foramina. Question. What is a shallow depression on a bone? Answer: a fossa. Next question. What is the name of the ligament that surrounds the head of the radius and holds it against the ulna? Answer: the annular ligament. Next question. What is the name of the large hole in the mandible for the passage of nerves and blood vessels? Answer: the mandibular foramen. Next question. What is the term for the bony projections you can feel running down the center of your back? Answer: the spinous processes of the vertebra. Next question. What is the basic structural unit of compact bone? Answer: the osteon or Haversian system. Next question. What is the central canal in an osteon that contains blood vessels and nerves called? Answer: the Haversian canal. Next question. What are the small cavities in the bone matrix where osteocytes reside? Answer: lacuna. Next question. What are the tiny canals that connect lacuna and allow osteocytes to communicate? Answer: canaliculi. Next question. What are the cross connections between adjacent Haversian systems called? Answer: Volkmann's canals. Next question. What is the unmineralized organic component of bone matrix called? Answer: osteoid. Next question. What is the primary protein in bone osteoid? Answer: collagen, mostly type I collagen. Next question. What is the process of dissolving bone mineral and breaking down bone matrix called? Answer: bone resorption. Next question. What hormone stimulates osteoclast activity? Answer: parathyroid hormone, PTH. Next question. What is the term for the equilibrium between bone resorption and bone formation? Answer: bone remodeling balance. Next question. What signaling molecule is crucial for initiating bone remodeling? Answer: rank ligand, rankle. Question. What cell surface receptor on osteoclast precursors does rankle bind to? Answer: rank, receptor activator of nuclear factor kappa B. Next question. What protein, secreted by osteoblasts, acts as a decoy receptor for rankle to inhibit bone resorption? Answer: osteoprotegerin, OPG. Next question. What is the term for the layers of bone matrix in an osteon? Answer: concentric lamellae. Next question. What are the partially formed osteons or the remnants of old osteons that have been partially resorbed called? Answer: interstitial lamellae. Next question. What is the name of the bony ridge above the eye socket? Answer: the supraorbital margin. Next question. What is the hook-like projection at the anterior end of the iliac crest? Answer: the anterior superior iliac spine, ASIS. Next question. What is the name of the prominent bony point on the elbow? Answer: the olecranon process of the ulna.